now recognize the gentlelady from Washington, Dr. Schrier.
Thank you, Mr. Chairman. Thank you, Ranking Member, and thank you to all the witnesses for being here today. As a pediatrician, I first want to talk about newborn screening. I'm so happy that our committee is considering the Newborn Screening Saves Lives Reauthorization Act, which is legislation that I co-lead with Dr. Morrison. The heel prick blood test that every newborn in this country gets is a simple, low-cost, effective tool to identify and treat so many rare diseases. In fact, I was recently at a food bank in my district, and one of the volunteers there was a teenager who I diagnosed when she was born with PKU, phenylketonuria. And she is doing so well and thriving in high school because of this early detection and treatment, which she's been so good about doing. And I just want to tell you that, or tell everybody that without that newborn screening and early treatment, she would not have been diagnosed until permanent developmental delays and seizures and other just terrible outcomes. So this was really a godsend for her. And this is the common denominator with all these diseases. They're rare, but early detection and treatment helps these kids live totally normal lives. And sometimes that's with diet, sometimes medication, sometimes gene therapy. And I just want to emphasize the importance and say that I really look forward to working with this committee to advance this important bill. I also wanted to touch on rural health, and we've been talking about the doctor shortage and the Improving Care in Rural America Reauthorization Act, which I co-lead with Congressman Carter. My district is 10,000 square miles, and so it includes a lot of rural communities that depend on scarce providers and vulnerable hospitals, and this bill will help expand access. However, I just would be remiss if I did not point out that almost all House Republicans voted to cut $1 trillion from Medicaid just a couple weeks ago, and I just want to say that this one big ugly bill will close rural hospitals, and it will impact the very communities that we're talking about helping. And so this just feels somewhat hollow to be supporting this bill and at the same time taking away with the other. I was wondering if you could just touch on, in maybe 30 seconds, Mr. Morris, the impact of Medicaid cuts on rural hospitals and the already existing shortage of primary care doctors.
Thank you for the question. I'll defer the workforce portion of the question to my colleague. The passage of the bill, we're still reviewing that language. And
Can you move the mic a little bit closer?
I'll defer the primary care question to my colleague. On the passage of the bill, we're still reviewing the language in the bill, and obviously it will be implemented by the Centers for Medicare and Medicaid Services, and we're there as a resource as they work through it.
We anticipate, the data shows that it will close 1 in 4 rural hospitals, just to let you know what you will find when you look at the data. I also wanted to talk about the physician and nurse workforce, because we're considering the reauthorizations of Title VII and Title VIII health workforce programs, and this ensures that we have the physicians, nurses, dentists that we need to serve patients, particularly in rural areas, and we do need a bigger pipeline, and we need these programs, and I support these programs. And again, though, I just have to say that this feels hollow to hear my colleagues' support for Title VII and Title VIII when they just voted to severely limit financial aid for medical and nursing students, capping the amount that they can take out, making it so that interest starts accumulating immediately, making them more expensive and lengthier to pay off, and that these are the exact students that we are talking about who would benefit from Title VII and VIII. In addition, the Trump administration has proposed gutting most of the nurse workforce programs within Title VIII. Dr. Chen, it's great to see you again, fellow pediatrician. What will happen to our health system if your agency loses funding for nurse workforce programs like the Nurse Faculty Loan Repayment Program and the Nurse Education Practice and Retention Program, and loans become more difficult to pay off?
Yeah. I think I can, I'll just reemphasize that we do know that our programs are impactful, that they have made a difference in terms of workforce shortages and distribution of the workforce. I think what we realize, though, is that the president's budget is the beginning of the conversation, that Congress ultimately makes the final decisions. And we are ready to work with you on that.
We think so. I hope that this Congress stands up for bills that we pass in a bipartisan way and does not let this president do a run around our power of the purse. Thank you, and I yield back.
Gentlelady yields back. Now recognize the gentleman from Texas, Mr.